Hello. I hope that you were able to enjoy your Labor Day with your family and that you were able to reflect. It is hard to imagine that September is upon us, but the summer has gone fast and it has been very, very busy for our Inspira family. We find ourselves in situations that the reality is that all of our expansion of our programs, which we're so proud of, especially our cardiac program, has really caused us to be able to do a lot more services, but it also means our staff is a lot busier. You know, I know that this time of the year is often very busy for families. They have young children going back to school and they have their adult children or teenage children going to college. And what we know post-COVID is that 1 in 5 children under age 21 are suffering from anxiety. And I just want to remind all of you that our Inspira Behavioral Health Program is here to work with your families. You know, for some of us, we may be of the age that we were taught that you don't talk about those things and you don't talk and ask for help and you can just, sort of muscle through this yourself. The reality is that you wouldn't muscle through a chronic disease yourself. You would get clinical help. And that is indeed what our behavioral health experts are here to do. This week is National Suicide Prevention Week. And, it is just terribly frightening to think about all of the challenges people feel, and especially during the times of great struggle when it comes financially. Those pressures, especially if you're responsible for your family, can really just eat at you, and making sure you know where those resources are available. And we've got some of them for you on the screen. This is a national suicide prevention line, but we can also work with you at our Inspira Behavioral Health Program to provide those services and link you to the things that you need. Speaking of supporting family members, one of the things that we really have learned over the last 20 years is the early diagnosis and detection of prostate cancer is critical. And making sure that we can do that only happens if indeed you are able to have your prostate screening. You know, it's one of those that I know people push off, but it is so critically important to make sure that you have it and to make sure that it allows you to have that peace of mind that no, everything's fine, or if not, that we're here at Inspira to walk that journey with you. One of those examples of how we've walked the journey with you came from one of our patients, Mr. Everett Brown, who was recently meeting with Dr. Lukowski, his primary care physician, who'd been part of their family. Both his wife was under his care as well as he was. He noticed a great swelling in his legs, and Dr. Lukowski, knowing Everett's history, said, you know what? I would feel much better if we got you over to the emergency room right away. See, we know that Mr. Brown had had a really tough time. He had lost his wife in February. She had really managed his diet and made sure he was eating the right things and getting the right exercise. And what Mr. Brown and Lisa shared with us was just the attention and care that they received from both the emergency room team as well as during his entire admission. And, this had not been the first time they had seen that kindness. See, they have a long relationship with Dr. Lukowski, and Joanne was a nurse at Inspira. She had been at Woodbury, started her career there. And even when Joanne passed, Mr. Brown said that he was so touched that Dr. Lukowski took the time to reach out and offer his condolences to the family. And so Lisa saw that, and she said, this is where I want to work. I want to be part of this. And she works with us as a receptionist in Tomlin Station. And, it's just such a special relationship that we can have here. It really is about family and friends and neighbors taking care of each other and really watching over each other in times of great joy and times of great sadness. And that we understand, as Dr. Lukowski did, that, I'm not only your physician, I'm a part of your family. So of course I'm going to call and make that extra effort to offer condolences. And I'm going to make sure that if I see something that I, don't want to just send you home to manage, I want somebody else to take a look at it because I want to make sure you're on the right track. And what Mr. Everett Brown said was he really put him back on the right track and got his, program back underway. And, it's just, I'm so grateful that people are so willing to share these personal stories with us and allow me to share them with you, because that really is what matters, and it is what makes Inspira and continues our deep commitment to you. Until we meet again, be well and stay safe.